Right.
Okay.
See, look, I was looking at that, and I was thinking it's a very vast and a broad question. There can be a whole range of not just rashes, we call it. I'm just going to say lesions, right? Whole range of things that people can notice down there, and they can range anywhere from tiny pimples. They can have boils down there. They can have bigger boils that we call abscess. Then you can probably have a rash. You can also have blisters, which are tiny, like fluid-filled bumps. And then you can have ulcers, which is like a break in the skin and it's an ulcer. And you can also have other lumps and bumps, which could be STIs, like, for example, warts, or, there's another thing called molluscum. And then you can have sebaceous cysts and different kind of cysts. So honestly, there can be a whole range of things that can appear down there, like any other part of your body or any other skin. I feel like, I always feel like sometimes when things happen down there, we tend to not pay attention to it until it gets really, really bad. Or we also feel or push off going and getting it checked straight away in the fear of, showing either our private area to someone else or discussing about the private area to someone else. Or even if you had something to say, or if you're a sexually active person, let's say, the whole thought of, I don't want to talk about this. I'm not sure if they're going to judge me. There are so many things that actually postpones this whole thing of going and getting checked when things happen really small, right? So I think when something appears down there, which is not usual for you, and especially if it is painful or itchy, if it's bleeding, if it's causing you any kind of discomfort, the first thing I feel like you need to find a doctor and get it checked. Right? It could be a whole range of, anybody from a dermatologist to a gynecologist, but getting checked is very important because you need someone to reassure. Initially, let's say, if you're hairy really down there and you do shave a lot, when you're shaving a lot and when the hair grows back, sometimes you have small pimples, coming out of it. Some things like that, you might be used to seeing it over and over again because you're shaving and you're doing all those things from a very young age, and you may not worry about it. And that's okay. But for your normal, if you see anything out of the blue, you're not sure, just get it checked. Even if it's a small boil, even if it just needs some antibiotic cream on it or something like that, it's always better to get it checked. And I really want to say this right here before we go forward, because when you're getting things checked, guys, I think a lot of the time people who are sexually active are also hoping that the doctor is going to come up with that question and break the ice. But sometimes I think we are living in a culture where it's not, normalized everywhere. There are some people who come up with it, and probably the doctor is thinking, I just hope she just opens and tells something if she's at a risk or not, rather than me coming up with a question of, are you having sex or not? Like, you know what I mean? So I feel like there could be tension both ways, but it has to be a whole community change. So if it's for you and you guys really are worried about, oh, I had sex with this guy, but I'm worried if it is something, just spit it out. Who cares? If you feel like she or he judged you, don't go there again. Find another one. It's a big country. Many people are there. So you can move on, and nobody cares. We shouldn't care about people judging at all. So I feel like there can be a whole range of, everything that I mentioned now. But getting it checked is very essential, and you can move from there as to what it is and not.